It's important to continue the momentum with drive-throughs. We need to remember that even though Pacific people account for 16% of the Auckland population, they also accounted for 28% of Omicron cases in Auckland to date. This peaked at more than 50% earlier in the outbreak. And remember, 43% of all hospitalisations in this outbreak have been Pacific people. And this peaked at around 60% earlier in the outbreak. I think there's a few vulnerabilities for the community in the coming months. We've got a surge in July and August that's been predicted by epidemiologists at the University of Auckland. There's the flu season coming up, so we have vaccinations to give for influenza and also vaccinations to give for COVID-19 and Omicron. And we need to be mindful about new variants and what impact they may have on the population as well. The messages that we need to communicate to the Tongan community now, I think it's important to reflect on stories about real people and their experiences with COVID. And there's a range of those from, less severe to severe. And I think for those who haven't been infected, those stories, they show people in that spectrum what they can expect and how to respond to it. Other things are about educating people about healthy lifestyles, making sure that people understand the new government frameworks around COVID, particularly the traffic light framework, the vaccine orders. There's a lot of shifting messages. There's changes all the time around when to self-isolate, when to take swabs, who's affected in terms of critical workers. So when these things change, it needs to be communicated in the Tongan language so people can understand it. The other messaging that we need to do is around the support we need to provide to people, wraparound support while they're self-isolating. Rangimalia can offer a range of support, social services support, clinical support. So if people who are our registered clients want support, then they're more than welcome to contact us, and we'll put a package of care and support together that's appropriate for their needs.